All right, we are broadcasting. This is interesting. COVID times.
It's weird. As soon as you did that, it got a little slow.
Can you hear me fine?
Yeah, it's just a bit delayed.
Oh, it's a bit delayed. Okay. Let me see if I can fix that.
We're good now. You're good, Sam.
Okay. Okay.
Do you want me to start off or you?
How about you start it off since you're JoAnn is one of your agents. Actually, I'll start off because I'll introduce myself and then I'll introduce you and then you can go. I'll start off.
Okay.
Hello, thank you everyone for joining. We're going to get started shortly. Happy Friday. We're going to get started in about 1 minute. Okay, let's go ahead and get started. Welcome everyone to the Caregivers Conference. I'm Samantha Anderson. I am the Business Development Manager for Northern New Mexico. Today we're going to be talking about Medicare, and it's going to be a lot more clear about how it works and how an organization like United Healthcare can help those that you care for. So let's go ahead and get started. You can see contact information here on the screen for JoAnn Medina. She is a local agent in your area. She represents United Healthcare. And if you have any questions after this meeting, you can contact her at 505-899-5500 and set up an appointment to see how she can help you make a decision for your those you're caring for and their Medicare needs. So let's go ahead and get started. We're going to talk about Medicare Advantage and what Medicare covers and how Medicare Advantage can help supplement that. So this is me, I'm Samantha Anderson. I'm the United Healthcare Business Development Manager for Northern New Mexico. If you have any questions about United Healthcare or need help finding a local agent, you can also reach out to me and I'll give you my contact information after this meeting. And your local agent who we're highlighting today is JoAnn Medina, and her leader, Brandon Malone, is going to talk a little bit about her and how she can help you. Take it away, Brandon.
Hi, good morning. So my name is Brandon Malone. I'm the Regional Sales Director for Fidelis Consultants. JoAnn is an agency that falls under us. We partner heavily with United Healthcare. So I'm stepping in with her or for her this morning because there's been some stuff going on with her. So if there's anything that we can help you with, we'd be happy to help you. You can see her contact information up on the screen right now. You can take a screenshot, write it down, however you'd like. JoAnn is a local agent. Her entire family is local to Rio Rancho, Albuquerque area. She's been in business in New Mexico since 2006, and Her agency is one of the fastest growing property and casualty agencies that's in the country, really. She prides herself, and all of her agents pride themselves on really working with the community and supporting the community, and being out there educating folks, and being a resource for them. So they're a great group of people. JoAnn's a very sweet lady. She's very hardworking. She'll always be available for you. So I'd encourage you guys to reach out to her for any questions you may have. So we can go ahead and jump into it. Next slide there. So some of the things we're going to cover today are understanding your Medicare choices, eligibility and enrollment, the advantages of Medicare Advantage, prescription drug coverage, the 2021 Medicare Advantage plan information, going over agent assistance, additional resources, and why United Healthcare. So the first thing we want to talk about is understanding your Medicare choices. So step one is enrolling in Original Medicare. Original Medicare, it's provided by the federal government. If you've worked your 10 years or 40 quarters, or if you've been disabled consecutively 24 months, or if you have any of the specific health conditions that allow you to have Medicare Part A and B, that would be things like Lou Gehrig's disease or end-stage renal disease or ESRD. That allows you to pick up your Medicare Part A and B. Part A is your hospital side. That's going to be the 4 walls and box of tissue. Part B is your professional services, doctor's visits, outpatient care, surgical services, things like that. Typically, Part A is your premium free. Doesn't cost you anything if you work 10 years or 40 quarters, or can qualify via Social Security with a spouse or a parent. And then your Part B typically has a premium of around $135 to $144 a month for your Part B premium, and that's going to be what helps take care of your doctors and surgical services, things like that. And then if you want to go to the next slide, Sam. All right, so understanding your Medicare choices, right? So option 1 or option 2. So you kind of come to a T intersection when you have Medicare, Original Medicare Parts A and B. Left-hand turn, or option 1, you could have Medicare supplement plan, and then you have to add a Part D prescription drug plan to it. If you don't enroll in both Part B or Part D as in drugs when you're supposed to have, there's actually some penalties that can be associated with that. So you have to make sure that you include that Part D benefit. Medicare supplements are kind of like the cleanup net that picks up everything that's left over from Original Medicare, and there's different letters and types of coverage you can get with Medicare supplement, but those pay secondary to Medicare. Medicare Advantage, which is predominantly what we're going to be speaking about today, that gives you extra benefits. It wraps your A and B together and coordinates that benefit for you, and gives you extra benefits. In some cases, things like dental, vision, even actual routine physicals rather than just your wellness visit where the doctor runs by and says hi and bye. So that's kind of what we're going to be talking about today. Part C wraps everything together, typically includes your prescription drug benefit, and then there's different networks and things like that. And we'll get into that a little bit later. Next slide. So eligibility and enrollment, right? So Medicare eligibility. So you're eligible for Medicare or Original Medicare if you're at least 65, like I talked about. If you're under 65 and qualify basis of disability or other special situation, which typically that's 24 months, and you have to be a U.S. citizen or a legal resident who has lived in the U.S. at least 5 consecutive years. Next slide. So when can you enroll in Medicare Advantage? So that you have your initial enrollment period, which is typically when folks age in when they're on their 65th birthday. So that's usually 3 months before, the month of, and 3 months after. It's that 7-month window. You may choose to join a Medicare Advantage plan or Part C or prescription drug plan at that time. And although you're not required to enroll in Part D, there is that penalty like I talked about. It's 1% of the national average for the monthly premium. So it adds up over time. So for every month that you don't have that Part D plan in place, it's 1% of the national average, which right now is about $35. So you're talking 35 cents a month compounding, and that sticks with you for the rest of your life, unfortunately. Next slide. All right, so this slide's talking about eligibility enrollment, talks about the enrollment period. So right now is the annual enrollment period. That's October 15th through December 7th of each year. That gives you an opportunity to look at the plan options and make a change if you would like. And then the last plan that you enroll in wins, and that's going to be for a January 1st effective, for the following year. So right now would be the time to enroll if you're looking at Medicare options or have clients that are looking at Medicare options. The open enrollment period, or it's also called OEP, it runs from January 1st through March 31st of each year. That gives you a one-time opportunity to either go back to original Medicare and pick up a Part D prescription drug plan, or change your Medicare Advantage plan for a different Medicare Advantage plan. But you get one opportunity to change. That replaced what used to be called the Medicare Advantage disenrollment period. Next slide. And then you have special enrollment periods, right? So special enrollment periods can revolve throughout the year. There's many different periods, things like if you are retiring and losing coverage, if you, so you're specifically losing group coverage. If you move out of the planned service area, the first 3 quarters of the year, if you have extra help, so you have low income subsidies through Social Security Administration, or if you have Medicaid through the state, so like Centennial Care for New Mexico, that gives you a revolving enrollment period for the first 3 quarters of the year to be able to change. Or if you've been diagnosed with certain qualifying chronic health conditions and there's a chronic health plan available in the area, that's another example of a special enrollment period. There's many others that's not all inclusive, that just can kind of give you a brief idea of how those special enrollment periods work. Next slide. So the advantage of Medicare Advantage, right? So these are some pretty staggering statistics. So 24+ million people are enrolled in Medicare Advantage plans as of February 2020. 93% satisfaction rate among seniors with a Medicare Advantage plan, and 25% less spent on healthcare compared to original Medicare. You have better managed care with a Medicare Advantage plan. You have more ancillary benefits, so dental, vision, things like that, that are typically available with the Medicare Advantage plan. So you have a whole health approach, which ultimately saves the system, but also the patients more money in the long run. So your health is incredibly important. United Healthcare does things very different for folks too, because they include things that help you with making sure that not only your physical fitness is in good shape, but also your mental health is in good shape. They're always on the forefront of making sure that they have the best resources available for people, whether it's going to be seeing providers remotely, whether it's different tools to keep you sharp while you're at home. We all know with COVID and this strange year and the strange times we're living in, having a healthcare company that partners with you to make sure that your whole health, including your mind and body, is taken care of, that's incredibly important. So those are some things that United Healthcare does very, very well. Also like to mention, which this isn't going to be found on these slides, is their retention rate. So United Healthcare typically has a retention rate of over 90% in most of their markets. The reason why that is people really love working with United Healthcare and having their treatment managed by them. They're a partner. So there's somebody that's going to be able to reach out and make sure that their members are in good shape, and they're very easy to work with. Customer service is the best, and just support. So next slide. All right, so this kind of talks about the differences between original Medicare and Medicare Advantage. You can see right there on the left, all the check marks, right? So you have coverage for your hospital stays, preventative services, coverage for some medical care like doctor's visits. It's kind of your routine stuff. Medicare Advantage plans in most, like I said, in most stages, they're going to include prescription drugs, routine vision coverage, routine hearing and hearing aid coverage. And then it also gives you a limit to your annual out-of-pocket costs. Original Medicare, you have your A and B deductibles, but then you have a 20% coinsurance on the Part B side. When you're talking surgical services and things like that get to $100,000 hospital bills and surgical bills, you need that annual out-of-pocket max. You need that safety net to protect you financially. So that's a benefit to a Medicare Advantage plan. Next slide. So 10 things to know about Medicare Advantage, right? first 5. So you must continue to pay your Medicare Part B premium. That's always going to be a must. You have to have A and B to have a Medicare Advantage plan. Medicare Advantage always is going to have you covered. Joining a Medicare Advantage plan may affect current coverage. It's best to use network providers. It's always going to be your least expensive route. In some cases, there are plans that are PPOs or even point of service plans that allow you to venture out of the network. However, this is one of those situations where it's always best to use network providers. It's the least expensive route, and you may qualify for financial assistance in some cases too. And we can always talk more about that later, things like low income subsidy and Medicaid. That's why it's always beneficial to meet with a local licensed agent. So if you enroll in Part D late, you may pay a penalty. We talked about that. It's at 1% of the average there. A Medicare supplement insurance plan or Medigap policy is not a Medicare Advantage plan. They work entirely different. One absorbs your AB benefit and manages it for you. The other one works secondary to your A and B benefit. You always want to keep your member ID card handy because you're only going to be showing your member ID card for your Medicare Advantage plan when you go in to see providers. And Medicare Advantage offers the same protections as original Medicare. Big thing is across the board, a lot of people get confused that there's millions of different preventative services, and there's even more that's covered with Medicare Advantage plans than just original Medicare. So it's always going to offer at least the same protections as original Medicare. And then you have a built-in financial safety net, which we talked about, that maximum out of pocket, which is incredibly important to be able to budget, especially in this day and age. Protecting yourself is key. Next slide. All right, prescription drug coverage. So this is going to go over kind of the high level for all prescription drug plans. This is the base that all prescription drug plans have to meet as far as that model goes. Some prescription coverage, also what's included in Medicare Advantage plans, can have difference in copays and deductibles, but they all have the same stages. The coverage gap works the same, and we'll explain that real quick here for you. So it breaks it down to 4 coverage stages. Your first stage is where you're meeting your annual deductible if the plan has one. And then you have your initial coverage where once you've met your deductible, then you'll have a co-payment or co-insurance for those prescriptions until you reach a total drug cost of $4,130. Once you meet that $4,130, you're going to now fall into the coverage gap, which is also called the donut hole. At that point, your prescriptions will grow to be a bit more expensive. They're 25% of your drug costs, and the plan pays between 5 to 75% depending on the drug. But typically you'll pay 25% of the drug cost until you reach $6,550. At that point, you'll fall into the catastrophic phase of coverage, which will drastically reduce your out-of-pocket costs. So pay the greater of either $370 copay for generic medications, or $920 copay for all other drugs, or 5% coinsurance, whichever is greater. And then that's all the way through the end of the year. Next slide. So what's the difference between total drug costs and out-of-pocket costs? So total drug costs is what you pay for prescription drugs each year, plus what your plan pays. It does not include your premium. So your premium is something you're always going to have to pay religiously, just like your Part B premium or paying for your electric bill. It's kind of the same principle. Out-of-pocket drug cost, that's what you're actually paying out of pocket. So that would include deductibles, coinsurance, and co-payments. And any discounts paid by drug manufacturers while you're in the donut hole. It does not include what the plan pays or your premium. So your out-of-pocket drug cost is what's actually coming out of your pocket. Next slide. So pharmacy network. So you can choose from 65,000 pharmacies, things like Walgreens, Smith's, CVS, Rite Aid, Kroger, which is also like Smith's or Fry's, depending on where you're located in the country. You can save on prescriptions while with in-network retailers. You always want to utilize in-network pharmacies. That's always going to be the least expensive route. And you can save even more by using mail service pharmacies, which we'll talk a little bit more also. United Healthcare kind of has that set up very well with Optum. So, but yeah, you can save quite a bit of money by utilizing your mail order service, especially if you have maintenance medications. I usually recommend to folks to utilize that for maintenance. The drug list or formulary. all prescription drug plans have a tiered formulary, tiers 1 through 5. So that's your preferred and generic drugs, usually on your tier 1 and 2. It's a lot of maintenance medications. And then some of your more expensive preferred brand name drugs or non-preferred drugs fall on your tier 3, 4, and 5. And 5 is your specialty drugs, which are typically like infusion drugs, things like that. Next slide. All right, so some things to know about with all prescription drug plans, included those that are also included with Medicare Advantage, is there's some money saving opportunities that are available, and a lot of the plans are going to utilize these different steps to be able to save you money, but they are important to know about too. So step therapy, United Healthcare can help you save money on your prescriptions by offering those lower cost drugs that can treat the same medical condition as your current brand name drug. So they'll usually recommend those lower cost drugs and then step you up to a more expensive drug if that drug does not work. There's quantity limitations too. So some drugs have quantity limits where the plan will cover only a certain amount of the drug for one copay or over a certain number of days. Those limits may be in place to ensure safe and effective drug use. Like this day and age with pain medications and things like that, you will have quantity limitations. And sometimes you can get a prior authorization though to be able to, or a formulary exception to be able to expand that for you. But a lot of drugs can also require prior authorization, some of those more expensive specialty drugs. Before the plan will cover those drugs, it may need more information from your doctor to make sure the drug is being used correctly for medical condition covered by Medicare. So you may be required to try different drugs before the plan will cover that prescribed drug, like we talked about, kind of like with step therapy in a way. Next slide. So asking for an exception. So I mentioned that a moment ago. So if you need a drug that's not currently covered by your plan, or if maybe you need to have it expanded if you need a different prescription. So you can ask the plan to cover your drug, even if it's not on the drug list. This is known as a formulary exception. You can also ask to waive coverage restrictions or limits on your drug. Those are known as utilization exceptions. So you can ask for those exceptions. You just need to go through your prescribing physician to do so. Coverage decisions are typically made within 72 hours. UHC or United Healthcare is very, very good about getting back with folks within 72 hours. You can request it to be expedited or fast, essentially, decision if your doctor believe your health requires it. And in some cases, that is the case. So you can ask for it to be expedited. Next slide. All right, so 2021 Medicare Advantage plan information. This is where Samantha is going to step back in, and I'll go ahead and mute myself here and step away.
Awesome. Well, thank you, Brandon, for going through that information. And I hope for everyone, it makes Medicare more clear and the options that you have available. You can understand how to use that and why it's important to possibly be on a Medicare Advantage plan. So let's go ahead and dive into some United Healthcare benefits. So today we're highlighting the Santa Fe area simply because the Alzheimer's Association in New Mexico is located in that area. We also do have plans in Bernalillo. So that's why it's really important to make sure you get JoAnn's contact information down. So if you live in another area, she can walk you through what's available. So in Santa Fe, this is what we offer. So we offer a AARP Medicare Advantage Choice PPO. We also offer an AARP Medicare Advantage HMO, and then we offer an AARP Medicare Advantage Patriot Local PPO. That Patriot plan is designed for individuals that are on TRICARE for Life or VA, so they already have prescription drug coverage, so that plan doesn't offer prescriptions. So let's go ahead and kind of talk about these benefits. So for our PPO, you can see that the monthly premium is $13. Our HMO has a $0 premium, and our Patriot has a $0 premium. You can see that with these plans, there's no medical deductible. And as Brandon was mentioning earlier, Original Medicare does have a deductible, so you don't have to worry about that deductible with your Medicare Advantage plan. As far as primary care provider visits, you can see that our PPO has a $10 copay. Our HMO has a a 5, and then our Patriot has a 0. When you are going for your yearly physical or wellness visit, that's going to be $0. When we look at specialists, the specialist is $40 with the PPO, $50 with the HMO, and $40 with the Patriot. And then we can see that across the board, even with our HMO, there is no referral required. So if any of our members or those that you're caring for need to see a specialist, you do not need to worry about referral. And that's a big deal for people in this demographic. A lot of our preventative services are going to be $0. So that's like your wellness visit, flu shots, mammograms, and colonoscopies. Those are going to be $0. If someone needs to go to inpatient, it's going to be $295 copay for days 1 through 6. With the PPO, $295 copays for day 1 through 6 for the HMO, and $275 copay per days 1 through 6 with the Patriot. What that includes is everything that happens in that hospital room. So if there's an anesthesiologist, surgery, medications administered, the bed, everything's going to be under that copay versus original Medicare just being 20%. So it really does save our consumers a lot of money by being on one of these plans. When it comes to skilled nursing facilities, it's the same across the board. So it's going to be a $0 copay per day, 4 days 1 through 20. And then after that, it's going to be a $184 copay for days 21 through 47, and then a $0 copay for days 48 through 100. As far as outpatient surgery goes, you can see that the copay ranges. When it says a $0 copay, that's referring to things like your mammogram and your colonoscopy. And with United Healthcare, if a consumer goes in and gets a mammogram or a colonoscopy, and let's say they get a colonoscopy and a polyp is found, it's still going to be $0 for that consumer. But that's referred to as outpatient. And then when you look at our plans, it ranges from $0 to $195 for our PPO, $0 to $175 for our HMO, and $0 to $150 for our Patriot. When you're talking about type 1 and type 2, type 1 is going to be an outpatient facility in a hospital. Type 2 is going to be an ambulatory surgical center. When it comes to diabetes monitoring supplies, across the board, we have $0 copays for your glucose monitors. So that's going to be Accucheck or OneTouch. Those will be $0. And then as an organization, we're also participating in the Insulin Savers program. So members are going to pay no more than $35 copays for their covered insulin. So moving on here, you can see that home health care, if a consumer needs home health care, it's going to be a $0 copay. So that's going to be referred by a provider, and that's no more than 35 hours a week, but someone can come and make sure, if they need physical therapy or medications administered, they're homebound and can't leave the house, that's going to be $0 copay. When it comes to diagnostic, you can see that it ranges from 0 to $115 for our PPO, 0 to $145 for HMO, and 0 to $115 for our Patriot. That's talking about MRIs and CT scans. And then diagnostic tests and procedures are $25 copay across the board. Lab copay, so if they need to get drug and urine tests, it's going to be $0 copays for our members. And then x-rays are going to be $15. And then you can see ambulance. That's a pretty big deal here because you can see that both for ground and air, it's a $250 copay. So if someone is far away and does need to get to a certain facility, it's still going to be $250 for an air ambulance. Emergency, we have a $90 copay within the country, but worldwide it is $0. And then, so that's if someone, let's say they're in another state or a county and they have an emergency, they're going to pay a $90 copay. It will be admitted if they're admitted to the hospital within 24 hours. With urgent care, that ranges from $30 to $40. So if they need to go into urgent care, if they have a cold or a skin rash or something, they're going to be able to have a copay for that. And then as Brandon was mentioning earlier, we do have that out-of-pocket maximum. So that's that ceiling that protects you from spending too much within the year. And Medicare doesn't have that. So if you reach any of these maximum out-of-pockets that you can see on the screen, that's all you're going to pay for the rest of the year for your covered medical services. So that really does protect our consumers from having huge out-of-pocket expenses for their medical care. And then you can see with our medications, the formularies for all these plans are the same, except for the Patriot. We don't have prescription drugs. That's why these plans are designed for individuals with VA or TRICARE for life, where they're already getting their prescriptions and they want to expand their access to care and maybe get some more ancillaries as well. So you can see here that we have our tier 1s and tier 2, tier 3, tier 4, and tier 5, and those copays on the board. As you can see with those $90 90-day, the copays are a bit less, especially for our tiers 1 and 2. That's through OptumRx mail delivery. So if members get tier 1 or 2 through OptumRx, they're going to pay $0 for a 90-day supply, which is really great. As also Brandon was mentioning earlier for those maintenance drugs, it really does save our members a lot of money. Then you can see that for a monthly Part B premium credit, we do have a $50 rebate for our Patriot plan. So that goes towards what members are paying for their Part B with Medicare. And then with our national network, our PPO plans have what is called a national network. So if you're traveling the US, you can pay in-network costs across the US for over 850,000 providers. So if our member is going to Florida or New York or Minnesota, they're going to pay those in-network costs with that PPO. And it's basically like being able to use your plan anywhere within the country. And our member services and agents like JoAnn will be able to help those members find those providers if they're traveling. And then our Patriot plan does offer some dental up to $500 and preventative. And then our HMO and PPO offer an optional rider to get additional dental up to $1,500 a year. Every year, our members get a $0 copay for routine eye exams. We're participating in that Insulin Savers program, as I mentioned earlier. So members will pay no more than $35 for their covered insulin. And then our Patriot plan offers $50 per quarter for over-the-counter items. And then you can also see that all of our plans offer a gym membership at no cost through Renew Active. So in New Mexico, any gyms that are participating in the Renew Active members can see. So they can go to more than one gym if they'd like at no cost. And then we have virtual medical and mental health visits for $0. Especially during COVID, mental health is super important. Members will be able to see their mental health providers for $0 and then also see medical providers for $0. And that's going to vary depending on what type of medical doctor will apply for this, but they will be able to pay that $0 copay. And now let's kind of talk about what our plans do for the caregiver of our members. So starting in 2021, our members will be able to bring their caregivers to the gym at no cost. So let's say you want to go to an Anytime Fitness. Typically, or any gym, sometimes they make you pay a little bit to go to the gym. I know I live in Minnesota, so I have to pay $20 sometimes if I want to bring someone with me, like my mom or my dad. So if you go to the gym with our member, if it's a qualifying location, you will go at no cost. And so it's really great. So you'll be able to go at the gym and help them, maybe assist them getting to the pool or on the treadmill, maybe get a little workout yourself as well. And really with our plans, a caregiver is defined as a person who is 18 years of age and older that has significant responsibility for managing the well-being of the person diagnosed with a chronic or debilitating mental or physical medical condition. So it's going to be available at select locations. And if you go to our Renew Active website, it'll say right on the screen if that gym allows a caregiver to come with a member. It's a really great benefit. And then we also offer a website. It's called www.uhcforcaregivers.com. So on that website, I encourage everyone on this call today to go take a look. It provides you with expert information to help you create the best plan of care. There's customized resources that help you meet the needs of you as a caregiver. We have a ton of discounted products and services to save you time and money. And there's a dedicated team of clinicians and experts to help you as a caregiver. So go ahead and check that out when you have time. And then another great thing above and beyond just the benefits we offer as an organization, we also like to make sure that we can help our members in their community and help them address financial and social needs. So we really do consider the whole person. So we have this program as a part of United Healthcare, and it's no additional cost to our members. It's called our Social and Government Referrals Program. So it assists the members applying for Medicare Savings Program. So maybe help them apply for Medicaid or a low-income subsidy, help them recertify for that, help with community-based programs as well. So if they need help with food, utilities, and housing, we can help the members find that. And then when it comes to veterans, we help them with chart collection as well and help them coordinate that health care. Another great benefit that we offer our members is house calls. So for house calls, we actually have health practitioners go to our members' home and basically do their wellness checkup, and they coordinate that with their primary care. And what that does is it helps decrease hospital admissions. So a lot of times members aren't necessarily going to the doctor, and with this house calls program, we can help identify points of needs and intervene when necessary if they need immediate or acute care needs. So it's a really great benefit. They don't have to leave the comfort of their home, and they can do an in-person. It's going to be a longer visit and really see how they can help coordinate their care with their primary care doctor. And you can see here as an example, we had 10 million care gaps closed in 2020 thus far. Another benefit that we really like, and we really want to make sure that we're providing our members with the help that they need and helping them navigate the healthcare system. And you can see by the name of this program, it's called Navigate for Me. And we really help our members, help them with pharmacy, financial, social, and behavioral needs, and medical as well. So for our members that have new cancer diagnosis, cardiac events, musculoskeletal, so joint replacements, chronic back pain, or even COVID-19, we help them get access to the care they need. So what they're going to have is a dedicated individual with United Healthcare that helps them scheduling an appointment, understanding plan benefits, finding potential savings on prescriptions and more, and it's no added cost. The Navigator team will work together to help provide the member with seamless coordination of health management and alignment with their provider's care plan. It's a really great program that we offer with United Healthcare, and it's above and beyond just those benefits. So for an example, during the pandemic, our Navigate for Me continues to offer navigation to members who are impacted by COVID-19, either with a positive diagnosis or potential virus exposure, to offer and help them with everything from understanding how to correctly quarantine and also ensuring access to food and medication. So we actually helped, Navigate for Me has helped serve as a hub to connect members to food resources. And then since March, over 1 million meals have been provided to UHC members. And along with that, so why United Healthcare? So not all of our Medicare Advantage plans are the same, and many private insurance companies offer Medicare Advantage plans. But when you choose United Healthcare, you're really choosing the industry leader, because we've been in the business for 40 years. We've been serving the Medicare community. More people choose United Healthcare for their Medicare plans than any other insurance provider. Members like to keep our plans, as Brandon mentioned, and you have our promise, and we are committed to helping you live a healthier life. That is our motto. And we have a lot of additional resources for you and our members. So we have that Medicare Made Clear. We have a Medicare helpline. We have Medicare and You. We have online plan finders, state resources, Social Security Administration is available to help you, and then administration elder care locator as well. So after this call today, what JoAnn can do for you is she can help you and those that you care for look up doctors, hospitals, specialties, and clinics to make sure that they're part of the United Healthcare Provider Network. She can check their prescriptions and medications. She can talk about access to additional resources and services. If you need help finding out if you're eligible for more benefits, she can assist with that. And then also, we do have, if you do work with a veteran, she can help with Medicare Advantage plan and how it can coordinate with VA or TRICARE for Life. So as you can see here, it's really important that you, if you have questions about United Healthcare, if you have questions about Medicare products and what's available to your loved ones or those that you care for or yourself, contact JoAnn Medina. Write down the 505-899-5500. You can also email her. And then she does have an office on 4801 Montano Road, Northwest B1 in Albuquerque. So she does have an office there for walk-ins, and give her a call and you can schedule one, and she'd be happy to meet with you in person and discuss your needs. Thank you guys so much for coming. And with that being said, do we have any questions?
Hi, Samantha. Right now, I don't see any questions. We can hang out for a second and just make sure if anybody has any questions, please post them in the chat and we can go ahead and have either Samantha or Brandon address any of those questions that you all might have. You can also visit the United Healthcare exhibitors booth, our virtual exhibit booth, by going to exhibitors, and then you can actually click on our exhibit hall, and there's a whole map of all of our exhibitors. United Healthcare is also in there. So if there are personal, I think you have the capability to go ahead and actually join a personal chat with them. And if you have any questions and you'd like to address them more privately, you're welcome to do that as well.
Yeah, and I will be in that chat all day. So if anybody would like to reach out to me, also my phone number is, I'm going to put it in the chat. It's 952-688-7039. So if you have any questions, feel free to reach out to me. I can connect you with JoAnn. And if you are not in the Albuquerque, Santa Fe area, I can also work with getting you connected to an agent closer to you as well.
All right, well, it looks like we can hang out a few more minutes, but it looks like you guys did a great job. If there's no questions, must have covered everything.
Lots of information, yeah.
Yeah, maybe, again, if you guys have any questions that were not, or regarding this information or anything that you, outside of this information, visit Samantha at the exhibit booth under the exhibitors tab on our event page. Or all right.
Perfect. Well, thank you so much. I'll be in the booth if anybody has any questions.